Hello, everyone. This is Dr. Jennifer Hobson from the Hobson Institute. I'm here with a dear colleague and friend, George Stortz. He is a physical therapist, recently retired, who has done the breathing clinic, the Hobson Institute Breathing Clinic, that I want to share his experience with the audience because he's had a pretty remarkable experience with the two times that he's done it. And I'd like to share that with everybody. So welcome, George. Thank you for being here.
Oh, thank you. I'm glad to be here.
So we've known each other for a long time, George, since me moving to Chicago and working with Peter McMiniman,
Right.
my first employer here in Chicago. So we share this common physical therapy profession. So you're not just the average patient, you know a lot about the body as well. So I just wanted to state that.
Okay.
Could you tell me why you took the breathing clinic? What were your symptoms at the time that you took them?
My symptoms were that I had sleep apnea. I had gotten atrial fibrillation, and upon researching all that, I saw there was connection between sleep apnea and atrial fibrillation. So I'd asked the doctor that was seeing me for the AFib about sleep apnea, and sure enough, I went and I got a test, and yes, I did have it. So I really wanted to do something about it. Well, they put me on a CPAP machine, which worked, but I just wanted to do something more. I wanted to see what I could do to help myself. And there were two main things: is learn to learn to breathe better, and number two, lose weight. And actually the two of those go together, because when you're not sleeping well, guess what? You tend to gain weight. And I was up to a rating of obese. My BMI was over 30. I was 227 pounds. And so coming to the breathing clinic was, one thing was just to reduce my dependency upon the CPAP and eliminate it if I could, but at least reduce my dependency and just be able to breathe better in all my activities, working out. I looked to bicycle, and during bicycling, I thought maybe there's something I could do better. So it was just an overall improvement in my health through better breathing. And you were very convincing. I had great confidence in you. You could help. You've just got that air about you. And I realized there was a lot I could learn. So yes, I would sign up for the breathing clinic.
So along with sleep apnea, George, were you also snoring? I know sometimes that is a very
Oh,
common thing to.
yes. Yeah, it was horrible for my poor wife, because it didn't bother me all that much, because I was in and out of sleep. But yes, it was pretty bad for Lori, and that was important to try and
Okay.
make her life better by eliminating all this noise at night. Yeah, it was very bad. And part of it is just due to the weight. That they say if your neck is a certain circumference, you tend to have sleep apnea, and so all those things again go together. So
Okay.
that improved it a lot, a lot.
So what are the concepts or exercises that you remember when you took it the first time around? What were the things that you started to do that were you changing these symptoms?
Um, a number of things. The the biggest concept for me was slow down, slow the breathing rate, because you tested me initially, and that was some ridiculous rate the way up there. And that the idea was to breathe slowly, and I'll use the word deeply, but in the sense of trying to move the air down into the lungs with expansion of the ribs and the abdomen, and not breathing hard and fast up here. So that was really a big concept. In just incorporating some exercises that you taught back then to kind of open up down here, tongue exercises and making strange sounds and all of that. Yeah, and that helped. And also just incorporating breathing and mild exercise. Like we would, at the clinic, we would walk around breathing and then hold our breath and see how long we would go. And that was kind of cool. I experienced some dizziness when doing that. I think my circles should have been bigger. I don't know. But yeah, a little lightheadedness doing it and all. But actually, I've incorporated that into my bike riding. And when I go out for a bike ride, for a part of that time, I will do, the specific nose breathing and then hold my breath for a while I pedal and then breathe again. And somehow I just think that continues to help.
Yeah,
And
that whole concept, sleep apnea, you tend to overbreathe. You tend to get used to a big volume. And so your body's requiring that. And a lot of it's through the chest and through the mouth. So we haven't really talked too much about nose breathing. Were you aware how much you may have been breathing through your nose during that time? That's one thing I find that people aren't as aware that their mouth opens up, and the volume changes when the mouth opens up.
Yeah, I was not aware of all the mouth breathing that I did. And the one thing I was doing when I had the CPAP, I realized that I was using nasal pillows on my CPAP, and I didn't have a sealed mouth to kind of close the system, and so I would put tape on my mouth. Doctor thought I was nuts. Then I met you and found out that I wasn't, that I was actually doing the right thing. But I would never think of doing kind of concentrating on the nose breathing during the day. It was mainly for just sleep. But with the clinic, I began to realize that, this is important to do the nose breathing all the time. And so that's when I started incorporating. The other thing I do is I do an app, a breathing app that you introduced me to, which starts your breathing at 8 breaths per minute, then it goes to 6, then it goes to 5, which is really a pretty low rate.
Yeah.
And you just follow the moving ball up the hill and down, along with kind of a chanting noise. And it's really mesmerizing. But I still do that now almost every day. It takes about, I think it's 5 to 10 minutes is all. I've never really timed it out. So it's not a big deal, but I do it almost every day and feel like I've done something good for myself when I've done it. Like it's a real positive to get that control. So
wonderful.
Yeah.
Now you are also a participant that came twice to the breathing clinic, and I wanted to ask, why did you come back the second time? Why was it that you felt like that it would benefit you?
Because I thought over time I had just kind of forgotten a number of things that you had taught that had kind of fallen by the wayside. And I know that happens all the time. As a physical therapist, give home programs of exercise, you realize, oh, you're not quite hanging in there. And I thought, wouldn't a review be a good idea? And so I came back again, and actually there was more stuff the second time that that you presented, and it was like somewhat overwhelming, but I'm certainly glad that I came back for the second time. And I would consider down the road, excuse me, doing it again. Because it was that important to me, and to get it right and to be
Right.
on top of it.
Right.
Yeah.
So could you share with the audience, do you feel that your snoring is under control now?
Yes.
Does it affect Lori, your wife?
No.
So she's
No.
sleeping better.
Oh, yes. Yeah.
And
I just don't snore, especially because I'm wearing the tape in nose breathing
yeah,
at night,
yeah,
either with or without the CPAP, depending, because there were months that I went with no CPAP. Yeah, it's all changed. Every now and
wonderful,
then, like if I
wonderful.
don't tape, Laura will say, "You were snoring last night. How unusual, Yeah, so it's been really good for that. Very good for that.
Now I know you've lost a lot of weight, and if anybody has taken a look at the website, the Hobson Institute website, and the PT Renaissance website, you'll notice a big change in your weight. So weight made a big difference, right? Weight loss. And you did Weight Watchers, correct?
Yes, I did.
And are you still doing Weight Watchers?
I'm currently not because of the coronavirus. I'm doing it at home, but I'm not
Right.
going to meetings and all. But I'm a lifetime member and will
Okay.
probably remain a lifetime member. But yes, I do. I'm on a program to maintain the weight. I went from 227 pounds down to I'm about 175 now.
Wonderful.
And I've maintained that for a couple of years,
Yeah.
I think. Yeah. So it just works.
That's great. That's great. I know how important the weight around the neck is to
Yeah.
reduce sleep apnea, along with the volume, the nose breathing, the taping at night, the tolerance to breath holding that you learned. I had one more question, George. What is some advice you would give to others that may be interested in the breathing clinic? What would you say to someone that you were talking to that had shown some interest? What would you give as advice to them?
I would definitely tell them to learn more about it, maybe contact you. And my second would be do it. Really worthwhile. I mean, it was for me. It was really worthwhile. You'd have to do the clinic, and then you actually have to go home and do it, which
Practice,
is also a problem for people. Like, go home and like, oh yeah, it's like in physical therapy, you'll take a course and oh, this is really interesting, and 6 months later it's all gone.
Right.
So you just really have to do it, and whatever part you decide you need to do. I couldn't do everything that was recommended at that time, but I've done a lot of things, just like saline spray for the nose.
Yeah. Yeah.
Have that. I have that in the bathroom, do it frequently. And then, I guess the third thing I'd say is that, you do it once, you practice it, and then I think it was really valuable to in some way review it all again, whether it's take another clinic or whatever, I don't know, but just to kind of reinvigorate yourself in the practice of your proper breathing. Yeah. And I would say, I feel there's so many people, it's terrible. There's so many people out there that are just not breathing properly. And I'm no expert, but I see it and I go, oh boy, they could really use they could really use the clinic, They could learn more about proper breathing. And I've read some too, I read Buteyko book.
Yeah.
Yeah, that, I need to review that again, but I think it's really a worthwhile experience. It was for me.
Well, I'm glad to hear that, George, and just know that there's another level that I'm working on that I'd like you to do at some point soon. So I will let you know when that course is ready. But it's more knowledge that I'd like to share with everybody here. And my goal is to try to influence positively as many people as I can to breathe better, sleep better, and just to be healthier. So George, thank you so much for spending this time with us. And I hope to see you in the clinic practicing proper and better breathing habits soon. Thank you so much.
I'll be there. Thank you very much, Jenny. Pleasure.